Thank you, Jay.
Okay, thank you, sir.
Yeah. Thank you, and that was a great talk, Jay. You've made my job easy by focusing on how PGs should attend conferences. Just a quick show of hands, how many of y'all are currently PGs in your first, second, or third year of residency? All of them, excellent. And that y'all have all chosen to come to AIOC means that there is an inclination for you to learn by attending these conferences. But very often we are spoiled for choice, because every other month, especially towards the second half of the calendar year, there is a meeting every weekend or every other weekend. So which one should you actually choose to go? So I think the first thing you need to evaluate is, why are you attending a conference? Now, as a resident, if you've done some sort of research, or whether it is a part of your thesis, or there is an interesting case that you've seen and you are keen to present it, so that would be one of the aims of wanting to present your research. And in that case, it depends on what you are presenting, because that will help you figure out which conference to present at, which is the most relevant platform. If it's a very, very focused specialty related topic, like say the proteomics of age-related macular degeneration or something, those topics are more suited towards subspecialty meetings like the Retina Society, VRSI, or subspecialty meets of retinal imaging. Whereas if it is a more general cataract related topic or a refractive surgery related topic, you may want to present it to a larger meeting. At the end of the day, you have to make a choice whether you want to attend local versus state versus national, or even an international meeting. But if it's basic sciences, by rule of thumb, choose the biggest platform. If it's more about showcasing your skills or interesting cases, or trying to build your own practice just after residency, you may want to make your presence felt at a meeting in the area where you've begun practice. So you can attend a local meeting rather than attending a all India conference, because your visibility and presence at the local meeting is going to add to your practice more. Why else to attend a conference? To learn, to keep updated. You have a new, maybe you are right now, you have an exam coming up later on in the year. Attending conferences like these that also have PG refresher course or sessions like this is great. You want to learn a new skill. There are skill transfer workshops here, focused subspecialty meetings because you have an interest in that. Also curriculum updates like the iFocus or the iPep or Kalpavriksha. These are great meetings to attend, to learn, to refresh, or just to, if you have before an exam, you want to give the ICO exam or an FRCS exam after your residency, you can still go and do this. Or you've bought some new equipment, say a LASIK machine, and you want to know more about the specifics of that. So, this is choosing the right meeting where you would like to gain more experience on that would help you. So what decides this would be your need and convenience. To network and collaborate. Because at the end of the day, you always want to stay connected with all your colleagues. And also you want to network with people who may be able to refer work to you. If you're a specialist after your fellowship, you want to build your specialty practice, you have to meet people, remind them who you are, where you practice. Find out that at meetings like this. If you have research that you're presenting, there's bound to be someone who's in an overlapping area of research presenting somewhere. Meet them and follow the, try to collaborate if you can. Like the YOC, which is a great, at the Yo Pavilion here this year, there was a great presentation, a wonderful presentation of individual cases by residents in training. And that is a great place to meet colleagues, figure out what is the kind of training that others are doing, to get an idea of your level and, to understand where you are in amongst your peers. To gain visibility, this is more a little bit after residency and not so much in residency. Also, you can meet people during residency and make an impression, because everybody needs visibility. If you present a free paper extremely well, you never know whose eye you can catch. Maybe the fellowship director in an institute, it was one of the judges or a panelist. And so it can also help you while you're in residency. And if you're just into practice, presenting always gets you more eyeballs, and it's important to highlight your strengths. What you are doing or what you are not doing is, so people know, oh, okay, if you're presenting a new technique or presenting tough, complicated cataract cases, complicated retinals cases, people know, oh, this is an area of expertise of his. Maybe you may get an invite to a conference based on what you've presented. So in a nutshell, your presence also matters more than just your presentation. So choose your area which will, choose a conference which will benefit you the most in terms of your input at the meeting. Sometimes it may work for you. This is me at IPEP 2000 and sometime. And that is a young me and a younger Dr. Santosh Sonavar who was presenting the award. And it was because I presented a case there in the IPEP as a PG, which I won an award and I'm receiving it from there. And as it turned out, my interest was in oculoplastics, and couple of years later, during my fellowship interview, he still managed to remember me, and as I turned out to be his fellow, and I was a part of the program. So sometimes there is a connect which you never know may help you somewhere in your career. And see, I'm now presenting in his course as well. So it's important to choose and make the most of the conferences that you attend. Also before setting up a practice, because you want to buy equipment, you want to know what is available, what is the cost, make groups, meet other colleagues, so you can even buy equipment in bulk, which allows you to get a better discount, understanding the business part of ophthalmology and not just the practicing of the ophthalmology. So for this purpose, a large national meeting like this is far more useful. You've got more vendors, you've got more people in the trade, and more delegates with whom you can connect and end up getting a bulk discount. So you'll ask, all of this is there, but I'm just a resident, but it's okay. When you're attending a meeting, don't be afraid to ask questions. Don't be afraid to walk up to leaders in their specialty or heads of department who've been presenting. Going up to the mic and asking a question takes a lot of courage. And nobody, it can be the silliest of questions, but you should ask questions if they come to your mind. Because attending meetings is only the one way you can help find your own niche and figure out not just what you are interested in, but also what you are not interested in. Like by attending the squint sessions in AIOC about 10 years ago, I had figured out that squint is something that I cannot do. It's just not my cup of tea. And also present, not just attend. Present papers, posters, if you have a manuscript and your thesis, everything should be converted to something that maybe you will present, so that can be the icebreaker, the conversation point when you meet people in your specialty. The expert may claim to be too busy to talk or might even rebuff you, but what have you lost for trying? So always ask questions, meet people, network. The importance of a conference. I was never big keen on, as a resident, I never thought conferences were very important. So this is 2010, me presenting my free paper in AIOC. It was a Friday, I presented and I headed back home in Bombay after the conference. The next morning, my mentor, Dr. Rashmin Gandhi, who was my supervisor in residency, called up and said, "You won the best paper award, now you have to present in Colonel Rangachari." And I said, "I'm not attending, you know what is there the next day." Sunday I was getting married. And he said, "It doesn't matter. Rangachari is too big a platform not to present your paper at." So I flew back Saturday evening, presented Sunday morning, and flew back Sunday afternoon to get married in the evening, which he also came and attended. So sometimes you don't realize, but later on you just need a nudge or a push to let you know the importance of presenting at these meetings. And finally, international meetings. At the end of the day, the quality of science sometimes at specialty meets abroad is better because they're presenting real, true cutting-edge science. And it's also, when you present at international meets, the honor and the prestige of having your abstract accepted and presented is something worth of appreciation. So at these places you can participate, engage with your colleagues, and also again, like I said, these present opportunities for collaboration. Why not to attend a conference? Just because your colleagues are going. Just because it's a nice place and you can do some sightseeing. Just because. For no reason, no. You need to plan. Try not to attend without presenting. Plan out your sessions. Check out the program. Figure out which sessions you want to do. Mark it in your calendar. If you're interested in oculoplasty fellowship, figure out the oculoplasty sessions happening, the cornea sessions if you're looking for refractive surgery. Read up on those papers if you take it one step forward so you can ask important questions, and follow up on connections that you make. Carry your CV or keep a copy in your inbox so you can send it if you meet someone who is worthy in networking. You never know when opportunities will come your way. And learn one thing that changes your practice when you're in a conference. Make sure that any conference abstract, I'll just finish in 1 minute, should be converted to a paper. So should your thesis be. So checklist: aim, plan in advance, submit the abstract, and then book the tickets. But what about the money? So every conference, if you look out, especially abroad, there are multiple conferences that encourage young people to attend. The APAO has 3 sets of grants for young ophthalmologists in training under 40 years, and each trainee outside the host country gets up to $1,000. So that's 30 people who will be given $1,000 for attending. Same is the case for APVRS, the Vitreoretinal Society of Asia Pacific. The Asia Pacific Society Oculoplastic Reconstructive Surgery has a travel grant. The ARVO has a travel grant if you have a really good basic science travel grant. Government agencies like the ICMR, SERB, DBT, DST, all of them also give travel grants. Last year, the AIOC itself had travel grants for the OC essay writing competition. The ARC thesis presentation still has a travel grant for prizes. So there are ways and means to make sure that it's not financially straining. To summarize, plan in advance so that you can maximize the outcomes. Align your goals by choosing the ideal platform where you can present and network. And at the end of the day, learn and have fun. It's not just about academics. Thank you.
Thank you, Akshay. That was very nice. WOC also has a lot of grants. In fact, I think 25 Indians got it this time. All of them are residents of Paris.
Wow, I didn't get it.
You are a pro now. Anybody has any questions to Akshay? Yeah, please.
Is that sometimes it's useful, to show your presentation or something, your video or something to a colleague or a friend or a senior mostly. Like even with the articles, Sunny sir helped me, and in the last conference, Dr. Akshay Nair helped me, and I didn't realize the importance of that video until he said, wow. So you should send it to ASCRS and it's been accepted. Now because he motivated me, you should send it to big conferences, it's been accepted now. So you can always, show it to your seniors because they have a better idea of which conference to send it to, and so it'll be good for you.